Hi everybody, this is Nilab Mohammed Rafi. In this PowerPoint presentation, I will be talking about paranoid personality disorder. Before we get into the topic, first we need to know what do we mean by personality disorder. The term personality disorder refers to a mental disorder in which an individual displays an unhealthy pattern of thinking, functioning, and behaving. An individual with a personality disorder has trouble perceiving and relating to the situation or people around them, sustaining their personal and social relationships, participating and developing academically, expressing their thoughts and emotions clearly and confidently. There are three main clusters for the personality disorder. So these personality disorders are grouped into clusters based on descriptive similarities within each cluster, such as cluster A, which is the odd and eccentric cluster, cluster B, which is the dramatic, emotional, or erratic cluster, cluster C is the anxious, fearful cluster. Cluster A includes paranoid, schizotypal personality disorder. Cluster B includes antisocial, borderline, histrionic, narcissistic personality disorders. And in cluster C, we have avoidant, dependent, obsessive compulsive personality disorders. And in this video, I'll be focusing on paranoid personality disorder. So paranoid personality disorder is a mental condition which is a chronic distrust and suspicion of others without adequate reasons, which is in cluster A, the odd and eccentric cluster. People with this disorder have unusual and eccentric thinking and behavior. They don't usually experience delusions or hallucinations. The symptoms start in the late teens or early adult years. There are some factors that can cause paranoid personality disorder in a person, such as biological, environmental, psychological factors. For example, childhood traumas that they have experienced during their childhood, physical, emotional, or sexual abuses that they have experienced in their past life can cause this disorder in an individual. There are some main symptoms and signs in this slide for the personality disorder. So people with this disorder, they are hypersensitive to criticisms. When they feel attacked, they fight back and they answer quickly, and they may accuse the target openly. They're not willing to take any responsibilities, whether it's their personal life or for social life. They're usually unforgiving and they're controlling in relationships, and they're suspecting others' trustworthiness and loyalty all the time. Whether someone does something good for them, they always think that there might be some catch somewhere. They're reacting inappropriately without understanding the situation clearly. They're being afraid of expressing their thoughts and their emotions, and even if they express them, it's unrelated to the situation. They overthink constantly about their future or about their actions that they have done in the past. And also they're very cold and distant in their relationships. They can't maintain any relationships or nourish any relationships with their partner, and they always feel that their partner is unfaithful to them or unloyal to them, so they cannot sustain any relationships. So in this slide, I will be talking about effective treatments for this disorder. Professional treatment can help someone with paranoid personality disorder to manage their symptoms and improve their daily functioning. But due to the nature of this disorder, people with PPD do not seek help usually, so they don't ask for help usually. But there are some medications that can help and manage the symptoms if they're very severe. For example, antipsychotics, they are prescribed to prevent a psychotic thinking that can occur in extreme depression. There's another one called antidepressant. They are the drugs that can treat depression by reducing the symptoms of agitation, sadness, inability to work, and interact with others in the surrounding. They're used for panic attacks, obsessive compulsive disorders, and chronic pains. There's another type which is called anxiolytics. They are drugs that relieves the symptoms of severe anxiety, panic attacks, short-lasting sleep disorder. However, there are many significantly effective therapies to reduce the symptoms to help a patient to recover and improve their maladaptive behavior. So the combination of the medication with the therapy can be very effective for individual with paranoid personality disorder. So there are three main types of therapies that can be very helpful and effective for people with paranoid personality disorder to overcome their fears and improve their personal life and social life. They are exposure therapy, psychoeducation therapy, and cognitive behavior therapy. Exposure therapy is developed to help people confront their fears and exposing the client to a stimulus that causes fear in a safe environment. Usually treats anxiety disorders by exposing them to with less fear to the most fear, floating, which means immediate exposure to the individual's greatest fear, which combines with relaxation techniques and exposing them to facilitate the process. Emotional processing. Exposure therapy can help the individual create realistic belief about feared stimulus. These therapy can help the individual to unlearn some negative stimulus in a situation. And also repeating this therapy can decrease the person's reaction to that stimulus. And this therapy can also help the individual to overcome their fears and manage their anxiety. Psychoeducation therapy. In this therapy, the therapist explains and educates the individual to understand the mental health conditions, symptoms, and what to expect from the therapy. Educating and planning a patient's treatment using this approach is effective. The goal is to help people better understand mental health conditions. Many people suffer from mental health conditions and are unaware of what they should expect from their therapist and all other steps that are needed to help them resolve their problem. The therapist explains every aspect of the mental conditions and how they affect their lives, educates them about the mental issues they have been diagnosed with, recognizes and reports their symptoms, and encourages them to seek supports and help from others, help them and suggests a different lifestyle to help them move forward. Knowing and recognizing the illness and its symptoms is very much effective in a therapy. It is important for them to come with a solution to each problem and set clear goals to improve the mental health of the client. Making goals can be an important part of the recovering from mental illness and improving the client's health and life. With this therapy, the therapist can help develop setting the goals by teaching them how to identify and distinguish between short and long-term goals. They set smart goals and focus on the process to overcome all the fears that the client has in a situation and try to achieve the goals with the therapist. Cognitive behavior therapy is one of the most effective therapy for people with paranoid personality disorder. This therapy helps to identify and change destructive or disturbing thought patterns that have a negative impact on their behavior and emotions. This therapy mostly focuses on problems, which is critical to learn how thoughts, feelings, and situations can contribute to maladaptive behaviors. The process can be challenging, especially for those with difficulty with self-analysis, but ultimately leads to a self-discovery and insight that are essential for successful treatment. The individual can develop critical thinking skills to identify and solve their problems, This therapy helps identifying the problems, developing a list of viable solutions, evaluating each solution's strengths and weaknesses, choosing a solution and implementing that solution, which are the most effective steps of this therapy. The therapy is result-oriented and emphasizes on the client's participation and cooperation, which is more effective for the therapy. And this therapy is progressing very gradually, but it's very important for the therapist, for the client to cooperate with the therapist in this therapy. So in the last slide, I have a list of some disorders that could benefit from CBT, for example, depression, anxiety disorders, phobias, PTSD, and some others. And that's it for my presentation. Thank you for watching.